a spirit of cooperation and collaboration through the years. And these vaccines that have been brought to us will be of great help for us. The Federal Ministry of Health knows the importance of having a healthy nation. So all the policies that we put in place and the collaborations have to do with ensuring that our citizens are healthy.
We are really grateful to the US government, represented here by the US ambassador, for coming to help Nigeria with the first batch of mpox vaccine. These vaccines have to be used in line with the recommendation of Strategic Advisory Group of Experts on Immunization, targeting both the prevention, pre-exposure, but also post-exposure. They are not vaccines meant for mass vaccination. They are targeting the risk group, affected people, and their contact in kind of ring vaccinations.
It is really an honor for UNICEF to have been invited here today to be witness of this solidarity and support that the United States government through USAID has given to Nigeria through the vaccines of mpox. As we know, the country has some cases. It was reported precisely last week in a meeting we had with NCDC and WHO. But we are very positive that this situation is really manageable. I think that lessons learned from the COVID will also guide us through the right path, emphasizing on prevention, providing timely information, working on social behavioral changes approaches, on infection attention, and surveillance, which is part of the to-dos of our sister agency, WHO.
Today's a good day. Any day we're going to make Nigerians more healthy, all of us working together, that's a good day. So thank you for joining all of us here. Thank you to all the distinguished guests that are here. And I particularly want to say thank you to my colleagues from the U.S. Mission and from USAID across all our health team at the U.S. Mission. Health, our work with our Nigerian partners on health, is one of the biggest priorities that we all have at the U.S. Embassy and the U.S. Mission. And I want to particularly thank all of those members of the team that are here today. So, as I said, a good day. And so I'm very pleased to be here today on the occasion of this handover of 10,000 doses of mpox vaccines donated by the U.S. government through the U.S. Agency for International Development. These vaccines are going to support the government of Nigeria's response to the current mpox outbreak, which has been declared, as we just heard, a global emergency by the World Health Organization. You know, the US government believes that a global public health threat in one place, a public health threat in any part of the world, is a global health threat for all of us. So that's why we have prioritized support for global health security, particularly in countries that are most vulnerable. So I want to commend the government of Nigeria, represented here by the Honorable Minister for Economy and Budget and others, for being proactive about leveraging support and leading a coordinated effort to respond to this outbreak before it escalates. The federal government of Nigeria has also shown its steadfast commitment to strengthening global health security by developing a national mpox vaccination strategy and development plan. And I salute the government for doing that. let me say, the U.S. government, through USAID, remains a committed partner to the government of Nigeria, a partner to strengthen systems that can effectively present, detect, and respond to public health threats. Our projects that we have with the Nigerian government strengthen the capacity of frontline healthcare workers and disseminates accurate communication messages on healthcare issues of all kinds to Nigerian communities. It is a great honor for me, a great privilege on behalf of the U.S. people to convey these 10,000 JYNNEOS mpox vaccines to the government of Nigeria to ensure the additional health, safety, and security of frontline Nigerian workers and others engaged in preventing the spread of the mpox vaccine. I'm pleased to be here today. Congratulations.
Today really represents something very important, which is symbolic of the collaboration and partnership that we have enjoyed from the United States of America in many regards. Our immunization program, our primary healthcare program, United States Centers for Disease Control through USAID, and many grantees that the government of the US funds to support us. This is a continuation of that. And I think I don't want to preempt some of the conversation, but I would just like to thank you all for coming, even with very, very short notice. Really say look forward to a good conversation. Thank you and welcome.